I'm Dr. Paul Cotterill. I've been practicing hair restoration surgery for over 22 years. I'm the past president of the International Society of Hair Restoration Surgery, as well as being board certified by the American Board of Hair Restoration Surgery and serving on its board as well as an examiner. I have offices in Toronto, Canada, as well as in New York City for consultations. The video you're about to see is an example of a consultation I do with patients. All consultations run at least 45 minutes long. This video will be somewhat edited so that we can hit the highlights for you. Additionally, the patient that you'll see now on consultation will be transplanted later on in the week, and we'll have follow-up videos for you to follow the progress. Thank you. Well, Mark, thanks for coming in to see me today.
Thanks.
So you're here to see me about scalp hair loss and looking into your options. A few questions first. How old are you?
I'm 35.
35. And I see you don't have any allergies.
No.
And you're not currently on any medications. And you're otherwise healthy.
Yes.
Great. How long have you had hair loss and thinning for?
I think I noticed about age of 29, it was starting to go thinner in the front. I noticed it because whenever light shines down through my hair, I could see that it was thinning, and it just seems to be mostly in the front and like up in here.
Okay. And have you used any special shampoos or medications?
I haven't tried any yet. I didn't think there was any. I didn't know if the shampoos really worked or if they were just sort of a scam.
Okay. And have you used any of the prescription medications on the market?
No, I haven't, but I've heard of Propecia.
Right, and we'll certainly discuss that. So you said you're 35. What's your father's hair like?
My dad still has most of his hair. It's thinner than mine, but it's sort of the same shape, but his the points kind of go up higher.
But he still has hair on his crown back here?
Yes.
And around the back and sides, would you say his hair is fairly thick and full?
He still has hair, yeah. He's still fairly full in the back.
Great. And do you have any brothers?
Yes.
How old and what's their hair like?
They're a couple years younger than me, 33 and 29. Their hair is still full as well.
Great, good. Well, you know, seeing that you're 35, certainly hair loss carries on throughout your life, but by about the age 35, getting on to 40, your thinning pattern becomes more established and hair loss begins to slow down somewhat. Still carries on, but it does slow down somewhat. Now, at this point, what I'd like to do is take a look at your scalp.
Okay.
Well, Mark, I'm looking at your scalp. I always like to look very carefully at the scalp and hair to make sure it looks otherwise healthy, and it does. You've got very nice density back here. I don't see any boils or pimples or circular areas of hair loss or anything else that might lead me to think that you have some kind of scalp disease going on, other than typical male pattern thinning. And it looks like, you know, you still have maintained the hairline to some degree. You are thinning out a little bit, and just as you mentioned, you're thinning in the recessions. There's some mild thinning carrying on into the crown through here, and we can discuss a little bit more about what you can do about your crown at this point. However, you mentioned the main reason you're here today is to look at options for the front half of your scalp. As well, looking at your hair, there's a 0 or 1 or 2 hairs coming out in gentle hair tugging, which is absolutely normal. You know, hair loss is not because of the shampoo you're using. It isn't because of hats or helmets or the wrong diet. Certainly mothers tell us that wearing baseball caps is bad, but that really does not cause hair loss. Well, Mark, from examining your scalp, you do have the appearance of early male pattern thinning. And the reason for that is male pattern hair loss is because of 2 main factors, genetics and hormones. So the genetics means you have a genetic predisposition or a tendency for hair loss passed on from either side of the family. It can come from your mother's side, your father's side, it can skip generations. In addition to having this genetic potential, you need to have a certain healthy level of testosterone, which is the male hormone you get in your bloodstream after puberty, which turns on male muscles, male facial hair, but then that male hormone testosterone turns on that genetic predisposition. So it's also important to know that, you know, having male pattern thinning doesn't mean you have a sort of a high level testosterone and you're a super male. It just means you have a normal, healthy level with the genetic input. So what can you do about male pattern hair loss? Well, your first option is do nothing. So if you do nothing, you'll have more gradual thinning. I can't tell you exactly how much more thinning you're going to have, but my educated guess gets better as you get older. And certainly by about the age of 35, you know, I can tell you will have more thinning. Whether or not you're going to go completely bald through there, time will tell. And we'll see how much genetics influence you have from your parents. In terms of what you can do, certainly it's not from diet or the wrong foods or shampooing too much or too little. There are some great medications on the market which can help to slow things down. Minoxidil it comes in a spray or as a foam. It's been on the market now as a spray for over 22 years and can help to some degree to slow down hair loss and may even regrow some fuzz. And then about 7-8 years ago, finasteride came on the market, and this is a pill. And what this does is it decreases dihydrotestosterone, or DHT. Remember how I mentioned that testosterone is the overall male hormone which brings out the genetics? Well, in fact, what happens in the body is testosterone is converted to DHT, and it's DHT which works on those genetically predisposed hair follicles to start the thinning process. So what this medication, finasteride, does is it decreases DHT. And the figures with DHT are, if you start it today, you have about a 90% chance, even 5 to 7 years from now, of maintaining the hair you've got on your crown. Now the crown is further back, so it works best in younger guys who have early ongoing thinning for maintaining hair. I was one of the investigators with Merck Frost, the company that produced it, and so I have a lot of information on that medication, having been an investigator. And certainly a small percentage of men do regrow hair. It works best, as I said, on the crown, but it may help the front to some degree. And those are all upsides. Another upside is it's a pill you take once a day. Now, a downside, it's a pill you take once a day. So once you stop taking it, hair loss will carry on at its normal rate. In terms of side effects, because it does decrease DHT, there are some sexual function side effects, but in less than 3% of men. The published figures are 1.8% of men may get a minor decrease in sex drive, 1.3% of men may get a slight increased difficulty with erections, and 1.2% of men may get a mild decrease of ejaculate volume. If you did have a side effect that you didn't like, just stop taking it and everything would go back to the way it was within a few weeks. So this does not change your sperm count or your ability to have children. And there is one big side effect in women. If you had a girlfriend or wife who had thinning hair, she should not take the pill directly. However, it is a very good and safe medication in most patients, and especially in fellows like yourself, who, when I look at your scalp, and understandably you're more concerned with the front, that's where you have the most amount of hair loss. You do have a little bit of very early thinning on the crown. However, because you are now only 35, we have to be very careful as to how much more thinning you're going to have in the future. And with hair transplantation, which we'll be talking about, we take permanent hairs from the back of the scalp and transplant them to where they're needed, and they will keep growing for the rest of your life as long as you had hair from where we took it from. So it acts like just where we took it from. However, it is a limited amount of hair. So if you only have so much hair available, for most people, the front half of the scalp is the most important area cosmetically. Your crown is another area which may get thinner in the future. And if we start transplanting your crown as well as your front, we might run out of hair. And that's hard to say in somebody who's only 35 because I don't know how much more thinning you're going to have in the future. So and in the meantime, if you're trying to buy yourself some more hair time, so to speak, I would think about taking Propecia or finasteride to maintain hair in the crown, which is just where I don't want to put hair in somebody who's your age because we want to make sure we have enough hair to do the front. So, the medication finasteride is a good marriage of medication and surgery. You use the medication to maintain hair in the crown, and if appropriate, think about having surgery, hair transplants, to beef up and augment the hair at the front of your scalp. So do you have any questions about finasteride?
Okay, if I started taking it on a regular basis, what happens if I miss a dose? Because I'm not very good at it.
Well, that's a good question. And you should get into a routine. Try to take it at the same time every day. And it does not interact with alcohol or other medications. But if you do forget a dose, don't worry about it. Don't take 2 the next day. Just carry on, because you do build up a level in your bloodstream. So try not to miss a dose, but if you do, don't worry about it.
Don't double dose or anything like that?
No, don't double dose. Okay?